Welcome back to the True Sports Physical Therapy Podcast. We got Dr. Ethan Hurd here, who just gave me a wink. I'm going to ignore that wink, but I'm thrilled to have you on. I've been so amazed at your growth since you've been with True Sports. Tell us a little bit about just some of your background, what your time's been like at True Sports, and we'll take it from there.
Awesome. So thanks for the polite words,
Sure.
Yoni. So my background in baseball came from a really young age, and my first exposure to PT was rehabbing a shoulder injury. I had dislocated a shoulder playing football. I had a massive posterior tear. I had a lot of complications after the surgery with my rehab.
Throwing side?
Throwing side, yeah.
Yep.
So real a lot of pain, really stiff. I had that stiff shoulder right out of the gate, and it was really tough. And I just went to a general outpatient PT. I went to my local ATI. It was the first thing I saw when I left school. So that's where I went, and I called home. And pretty much by the time I got cleared to start the throwing process was my last visit. They discharged me on that day, and they're basically like, good luck. So I kind of had to pick up the throwing program by myself. I didn't have any guidance whatsoever until I got to college. And then our pitching coach at Lebanon Valley was a gentleman by the name of Chad Shell. And he really put his arm around me and helped me out and gave me the original throwing program. And I started to work through there and ended up switching positions. I was traditionally a catcher, really tough spot to throw from for a shoulder injury. So I switched to the outfield, and things just really started to fall into place. I finished my tenure at Lebanon Valley. I stayed there for an additional 2 years, completed my doctorate of physical therapy program, and it started as a student in Lebanon, just right down the road from campus, and had a great time there. And then I was fortunate enough to continue my career with True Sports, and I don't second guess a single occurrence that happened in that really dark time of rehab, because it brought me right to where I want to be.
Okay, so it's interesting because I'm able to see this whole journey kind of firsthand and watch you come along as a student, watch you grow and blossom as an employee. Tell me about the difference between what you do every day compared to what you went through at ATI.
At ATI, I felt like a number. There was somebody coming in, 20 minutes right after I entered the door. If there were many times where I would even start a session on ice because they just felt like they needed to check a box and get it done. And I didn't really like that. There just wasn't a lot of opportunity for sports PTs in Southern Delaware, where I grew up. So when I started my student rotation with True Sports, the first thing I grabbed a hold of was 45 minutes one-on-one with the PT, and I just freaking loved it. And that's something I believe now it should be the standard. And I really want to push that forward in my career and spend a lot of time with patients, especially in those occurrences where, hey, we're doing return to sports stuff. Things are going to be uncomfortable. You need to have somebody watching you and guide you. And I really tried my best to provide as much feedback, the day after a throwing session or leading up to the throwing session, just talk about even just confidence, because that was something I know I lacked a lot. And I talk about different feelings that I had in my recovery with my patients. And a lot of times we have the same conversations I had with my PT at the time. And it's really reassuring for patients knowing that, hey, somebody has been through the same thing. They're feeling the same symptoms that I was. So I find that it's very comforting for a lot of people, and something that I really like to do, because I get to connect a little bit deeper on a more personal, emotional level with patients.
Yeah. And so that's awesome. That's great kind of advice for those who are in the hiring position to look for PTs that have been through it. I love looking for PTs that have been through specifically ATIs, not just sports injuries themselves, but if they've seen ATI or they've seen the mill model, watching them understand how imperative this one-on-one for 45 is a game changer. So I think that's great. And that's something that kind of drew us to you, is that we knew you had the ATI experience and that it wasn't ideal, and that you would then appreciate and maximize the opportunities here. So I think that goes a long way. So just kind of food for thought on the hiring process a little bit. But not everyone has the luxury of 45 minutes, right? Like that's an anomaly. So let's say you did work at an ATI. Is there any advice now, kind of looking back, that you could have given to your therapist? Like maybe people are listening to this and they're working at ATI or Pivot or whatever, and they're seeing one every 20 minutes or two walk in the door at the same time. How can a PT manage that?
That's a really tough question because then it turns into productivity standards. My best, I think my best answer would be see if there's a way that you can spend time later in the day working in that overtime to see the people that you want. Because if you can start to fill that schedule with people that you want throughout the day, that was something that Dr. Austin Kolish kind of keyed me into. It's like, hey, you want to treat a certain patient population, takes a little bit of elbow grease. You got to stay a little longer. You got to close that place down, stay 2, 3, 4 slots later with people that you really, really want. And then there's a way that you can start to really bleed them into the middle of the day. But if you're not willing to put in the additional time outside of the work that you're supposed to do, it's going to be really tough to build that patient population that you really want to treat, because it does take a little bit of elbow grease or going out to the field and talk to guys and do injury screens and reach out to coaches and even reach out to tournament directors. There's a big wide open area of sports coverage that doesn't get happen at the tournament level. So there's a lot of opportunities out there. You just gotta, put your nose to the grinding stone and do it.
Yeah. It's not always that easy. I think your point is well made that if you want to see the prep school athlete, they get out of school at 2:30, 3:30, 4:30. So you're going to be staying later. Maybe you shift your schedule to see them later. I know what I used to do when I would work in the mill setting is I would like do all of the garbage work beforehand, so that even if I had 20 minutes or 30 minutes with a patient, I could spend it with them instead of like handling the millions of notes. So I would like pre-write their note and not complete it until I'm done, try to kind of get that out of the way. Or I schedule them as my last patient because I know I want to spend more time with them, or I'll schedule them right before lunch. They used to give me a lunch. So I would like treat them through lunch, stuff like that. Just so you can try to spend time, because it's impossible to rehab these athletes at 20 minutes, the throwing athlete specifically. So let's dive into the throwing athlete. You've kind of made a name for yourself in the area as a baseball rehab specialist. Walk me through how you usually take athletes all the way back to the mound or back to the field.
So I think starting with, after you normalize your range of motion, you get pain under control, you start those exercises. The moment that I can start to train them in the position that they're going to find themselves in the most, I'm going to do that.
Which is
a lot of asymmetrical standing. So one foot out in front of the other, and I'm working in a diagonal pattern a lot. I'm working with that elbow at least at 90 degrees. If I'm working rotator cuff, I'm trying to graduate from neutral position to a more overhead position as soon as I can. And that kind of bleeds into your next progression. Once you get in that position, they're comfortable in that position with loading, controlled, slow, constantly, then you can start to add a speed component. So there's a lot of exercises that I'll do that are just standard traditional, like for example, lateral raise, just a dumbbell lateral raise, nothing sexy about it. But once they start to do that and they're at a safe timeline, I'm going to implement a drop catch at some point. And that's going to be the new standard.
Why do you do that?
To work on some of those eccentric controls. It's a lot of acceleration of the pec and lat, followed by an aggressive deceleration moment of the rotator cuff. So I'm trying to train deceleration and acceleration a lot. I'll do them separately, and then I'll start to blend those things in with, say, I'm just going to toss like a 2-pound med ball overhead. You got to catch it and slam it as quick as you can. But before that, I'm going to just toss it to you, and you're just going to catch it. And then after that, you're just going to do a single leg or a single arm overhead slam. And then as both of those independently look really good, I'm going to start to bleed those in together and make it more of like a training an RSI sort of movement and get really reactive with it.
Okay. Define RSI.
Reactive strength index is what the blanket on the words, but that's what RSI stands for anyway. Okay. Acronym. There you go. But what that is the ability to lengthen and then explode out of that lengthen phase. So baseball uses that a ton through the pec and the lat. As you reach that layback position, there's an extremely high torque and a lot of pec and lat lengthening through external rotation. and then they got to contract and pull that arm down, or else you're just going to sail it over the third base dugout. So RSI is really, we talk about it a lot for ACL care, but it's really hard to sometimes get that get the parallel for the upper extremity. There's a couple different exercises. It is tougher, I will say. Other exercises that I train a lot are going to be a supine or a hook lying med ball drop catch press. So I'm standing over the patient. I'm going to drop that med ball right at chest level. They're going to catch it, bring it to their chest, and they're getting rid of it as fast as they can. And that's done a lot through really light weights because I want to train the speed of it. The shoulder rotates at something like, I believe, 6,000 degrees a second. So we got to be really explosive.
Yep.
And if they haven't trained that explosively, I doubt that the throw is going to look really pretty, or they're going to be very apprehensive to do it.
Yeah. And one of the things I love is like hearing you work through these things, talking about how sports specific this is, even though it can be done early. Like they're just beginning to, they've achieved their range of motion. We'll get back into that in a second, but they've kind of checked off the basics, is like starting to introduce things that are sports specific and then explaining it to the patient. Like, here's why we're doing this. This mimics your throwing motion because of everything you just laid out beautifully. That creates a tremendous amount of buy-in. And when I introduced you on the pod as a baseball rehab specialist, it's like these little tidbits. Like, you're not reinventing the wheel. You're doing an awesome job of applying techniques that everyone knows to their exact needs of the sport, and then making the patient understand that, so that they can understand that, hey, yes, I'm doing things that are important for me, but I understand why they're important. My therapist has explained it. What kills me is, I'll see high level throwers and they'll come in, I'll be like, hey, have you done, let's say the med ball sequence that you were just describing? Or have you done like the drop catches? And like, they've never done any of this, and they've rehabbed at seemingly high level institutions or organizations. They just haven't done this, and it definitely hasn't been explained so that they can then regurgitate it back to the next therapist, or even for their own edification. So that's a big piece of creating that buy-in, like you mentioned, and really setting yourself aside. So setting yourself apart from other general sports practitioners, even, let alone your gen pop. So I think everyone that's listening, like, these are great tidbits that you can use to set yourself apart from everyone else in your industry, in your area, to say, this is the guy I want to treat with. This is why he's the baseball specialist. So that's not lost on me. That's really awesome. So let's walk all the way through a case of UCLs, because we want to get to our return to throw, right? So walk me through early phases of a UCL reconstruction, how that differs from an internal brace, and then some of the newer literature that's coming out on the return to throw mechanisms.
Right. So starting with just your traditional reconstruction,
right,
they're going to be in a splint for that first week. They don't really want you to deviate from that. So I typically see them at least 1 to 2 weeks after, and I'm not upset about that. Versus an ACL, I'd be a little bit more nervous.
Yeah, very nervous
yes. At that point. The nice thing is that the arm can relax, but it can also fight back really hard. So I'm gonna grade flexion. I'm not gonna push too hard. And I'm gonna let gravity do most of my heavy lifting for extension. I'm gonna do just a standard supine prop, or some of those trickier ones for, let's say you get to about like 4 to 6 weeks and you don't love what that end range extension looks like. You're lacking 5-10 degrees, and you really want that locking mechanism. I'm going to put them on their stomach. I'm going to prop their shoulder up. I'm going to I'll prop their palm up as well. And I'm going to lay a couple weights on the back at the side of their elbow. And I think that the really important thing about that extension, it's not necessarily that you're going to need all that extension to throw, because we're almost never going to throw with a tomahawk arm. The real important part about the end range extension is going to be that locking mechanism, like I mentioned. It allows that tricep to relax just for a brief moment. So if they don't have that end range extension, closed chain loading is going to be really fatiguing on that side. Mm-hmm. That's where you start to get scapular dyskinesis in there. And if we start to see scapular winging happen at the shoulder blade level, that's an unstable base, and we're trying to create a lot of force at that distal appendage. So I really don't like that. So I'm going to hammer extension. I'm going to get to it as quickly as I can safely, and I'm going to grade flexion. From there, it turns into a lot of tricep. I'm going to train tricep nauseatingly above the head, at shoulder level, at waist level. From there, I'm going to isolate my single joint movements primarily at the start. As they get more confident and those tricep extensions have a much buttery movement to them, they're moving a little bit smoother, I'm going to graduate them into a compound. My favorite freaking compound to start with for presses is going to be a standard floor press or a push-up. If you get into a standard push-up position, they feel really confident with it. Their hands are on the ground. It's really stable. And then from there, rows, pull downs, those are all going to be all appropriate. But primarily, I'm going to train a lot of tricep, that terminal elbow extension, just like we talk about TKEs with ACLs. Once I'm loading into a pressing motion, I'm then just going to grade the depth. So I don't go super deep with my horizontal abduction too much, like too early. I'm going to let them get to, a decent pressing weight, 45s to 30 to 45 pounds. And then I'll start to get them on a bench and let them cross past that neutral position, because that's where they're going to feel a little bit more of compression towards the outside part of the elbow. And if I feel they're feeling too much of that compression of the elbow, I'll just reduce that range again.
Hey guys, excuse this interruption, but I just wanted to give a quick shout out to our new Overhead Athlete course. This course teaches you everything as to how to get your athlete back on the field better, faster, and stronger. It is taught by a former professional baseball player, and we break down specific pathologies, exactly how to treat them, exactly how to load them, and exactly how to get them all the way back. So check out that Overhead Athlete course that we just launched. There is a link down below in the description. Now let's get back to our conversation.
From there,
hold on. So how much attention do you pay to shoulder range of motion in these UCL patients?
Oh, a lot. I think.
What are you looking for there?
I'm looking for their total arc. So their total arc has to be at least the level of their other side. Now, I had a really interesting case that I treated a guy for shoulder dyskinesis. He had a ton of layback, but never knew how to control it. Lots of scapular dyskinesis. We addressed it. He went through a complete overhaul of his windup, and then it was just too much on the UCL. He just wasn't used to that sort of stability at that point. Ended up popping his UCL, got the surgery, and now we're working through the return to throw process now. But I think it's a good example of there is a huge correlation between shoulder control, range, throwing biomechanics, shoulder pain leading into an elbow injury that there was never a problem at his elbow before. Yep. And just addressing his mechanics and getting an overhaul of mechanics, that can be dangerous too. Yep. So we have to be mindful of, hey, their total arc looks really good. Their even their pec extensibility, horizontal abduction, I'm really keen on. Pec extensibility, I'm really keen on.
Okay, do me a favor, define total arc, like what you're looking for, what you typically see.
Total arc is going to be the addition of your supine at 90 degrees of abduction, external rotation, and internal rotation. So there's a couple concepts of GERD, glenohumeral internal rotation deficit. The research on GERD it's kind of tricky to read at first. You want your total arc to be within 5 degrees of your contralateral side. Now, what you typically see with a thrower, and especially if they've been playing baseball from a young age, is that you'll start to see some humeral retrotorsion. That bone will actually start to twist when their bones are much more pliable and they've thrown a ton of volume. You will see a tremendous increase in external rotation, so layback position. You should see a equal decrease in internal rotation. Now, if you start to get into area code of, hey, I didn't lose that much internal rotation, but I have a ton more external rotation, that's more indicative of hey, they have a ton of laxity in that shoulder. And I'm thinking more of, there might be a labral pathology that pops in here, because if you get into too much layback, then you start thinking lots of stress on the bicep tendon. Yep. Slap tears start to come into the picture, and uncontrolled. And you could probably see more of an erratic throw, more arm side misses when they can't control the down portion of pull downs. They're just flying open. This is a really unstable joint. So
in those instances, I know we're getting a little bit off UCL topic, but they're interrelated. What are you doing with these hypermobile athletes?
Hypermobile athletes, I'm gonna try and stiffen them up. And if 4 to 6 weeks of me limiting their range, they still have a lot of range there. I'm at least going to get them very strong in those end ranges.
How do you do that?
My favorite is going to be a prone layback liftoff. I call it. Just prop their elbow up, get a weight, 5-10 pounds. And we're trying to lift that wrist up without peeking that elbow off the floor. Mm-hmm. They got to be really stiff there. You can do it in many different positions.
10 pounds is huge, and I mean,
it's crazy. They usually tap out. All my guys typically tap out at like 5 because they will get a lot of cramping going on in the posterior cuff. It's quite fascinating to watch them kind of squirm with just a simple exercise.
Yeah. So that's awesome. And then, okay. So and then talk to me about closed chain. Are you using closed chain in that hypermobile athlete to
100%.
Okay. 100%. So what's that look like?
I operate a ton out of the bear plank position. I do a lot of bear crawl variations. I'll do tripod rows out of that position. I'll do tripod banded tees. I'm really trying to get them comfortable and a lot of endurance in those closed chain positions, because I tend to find that a lot of shoulder, especially shoulder pain, when I work a lot of closed chain positions, I get results within 2 weeks.
Yeah,
they are very effective of letting them control their scapula, and it works down the chain. Yep. If your shoulder blade's stiff, it's strong, it upwardly rotates really pretty, good things tend to happen. Yeah. When they have resting upward rotation, when they don't have any control of their lower trap, I get really, really nervous about how that's going to go.
Yeah. That makes a lot of sense. I tend to do a lot of Turkish get-ups, a lot of carries and stuff like that. Does any of that in the open kinetic chain play into your role?
Yep, 100%. I do a tremendous amount of Turkish get-ups as well. I really like the protraction control that it requires. So being able to just keep your shoulder directly under that weight, that shoulder blade tends to fall right where it is if you direct them appropriately. Like, hey, don't let this hand deviate away from your shoulder. It needs to stay straight up.
Yep.
Think like a magnet glued to the bottom of that weight. It's got to stay straight to the ceiling.
Okay. Love that. Okay. So let's get back to UCL. So you started with restoring their ranges of motion. I love your idea of the prone hang, essentially, for the elbow. Mm-hmm. Sometimes I like using a duffel bag like I do with the knee, because you can put that superior and inferior to the affected joint and just let it pull down. How much attention do you pay to supination, pronation, and its effect on terminal extension of the elbow?
When I do my range of motion, I put them in end range extension, in pronation, supination, neutral. I get into pronation, supination almost right away. And I tend to find that it doesn't cause a lot of stress there, and they're a lot more relaxed. Mm-hmm. So pronation, supination, within the first 2 weeks, I'm doing end range at 90 degrees, wherever they're comfortable with that flexion level, or extension rather. And I'm going to consistently keep an eye on it. I'm going to consistently mobilize the radial head, because I tend to find that also helps with extension. Yep. So I'm going to control it. I'm not going to obviously crank through it. Everything with the elbow is really within tolerance. The bicep is really easy to kick on and guard. But with pronation, supination, I tend to find that it's really easy to get that back, and typically don't see a whole ton of deficits. But I will train extension in pronation and supination, equally as important.
Okay. So I just wanted to hammer those basics, because I know we're going to get into return to throw, but I think too often those basics are skipped over. And then if you're doing return to throw and you don't have your terminal extension, you don't have supination, pronation, you don't have your layback and all the stuff we discussed with the shoulder, you're kind of cutting off your nose to spite your face, I believe, is something my father would say. So I'm glad we covered that. So now, at what point post UCL is an athlete picking up a baseball?
That's kind of a loaded question. There's a lot of things they got to do before they pick it up. So a couple of things that we'll start to do around week 10, 12, especially more so 12, depending on the surgeon's preferences. I'm going to communicate with the surgeon a lot. When can they start doing handheld dynamometry testing? That's my first question, especially with internal rotation. That tends to be one that's a little bit more tender, and they're more apprehensive to do, but very important to know what that number is. So that's usually about the 12-week mark. Once they hit at least 80% of their strength, and I'm going to test flexion, abduction, shoulder extension, external rotation, internal at neutral and 90 degrees of abduction, and in a layback position as well. Once they pass those things, we can start looking at a double arm plyometric progression. From there,
by the way, Exos has a great playbook for that. We got that from Andrew Livingston, just the way they progress plyos, being intelligent about it. So I think that's available online, but go ahead.
Yeah, 100%. So once they hit their 80% of their values, they're able to start that double arm plyometric progression. I'll typically leave it at double arm, and I'll max out whatever the hardest, safest option for double arm plyo, whether it's a double arm pull down, med ball slam, chest pass variation, add some rotation in there once sagittal plane stuff looks really good. Then I'm going to start to bleed in a couple of single arm, low impact endurance movements. Once they start doing, say, like an overhead med ball dribble is a really good one to fill in as a endurance exercise. Once they start getting really confident with that and their double arm stuff looks really good. Unfortunately, there's not enough research to know when to switch to the single arm. It's really up to the execution of movement quality. Then I'm going to start to get into more single arm med ball slams. I might do a more like, almost like, I think of it like a Naruto punch, but kind of punch.
It's a Naruto punch.
Well, Naruto's like anime. I didn't watch a lot of it. Okay. But I'll start to bias like a single arm press through and start to cue them to actually like extend through that ball with one hand. When you can start to get into a split stance, rotational med ball, chest pass with single arm, that's where a lot of good things happen. And you'll find a lot of your baseball guys are already training that movement. Yep. And that is a very, very familiar position for them. That's a good indicator that, hey, we're getting pretty freaking close. With return to throw, the qualifications to start for me are going to be 18% of body weight, external rotation strength. So that is per body weight. So get them stepping on the scale, and it has to be at least 18. And you will find that on most of your protocols too.
In pounds, kilograms?
In pounds. Okay. In pounds. From there, your internal external ratio, or external to internal ratio rather, would be 67%. That's a little bit up and down. I've seen 63, I've seen 67. If you get it close to 65, you're in a good spot.
And how do they test that?
That is going to be tested in neutral, or I like to do a lot of like 90 degrees.
Okay.
And that could be through handheld dynamometer. You can do that through a tin deck. There's a new piece of equipment called like Arm Care. Yeah. I know we kind of talked about that on our regional meeting. It's a really fascinating device. It's basically a portable handheld that you put on the back of your wrist. And as long as you have something to push against, you can get a really good score. And a lot of high level baseball programs are already using this. So that number's got to be 67%. I'm going to work on a closed chain endurance stability test. That's basically 36 inches apart from the hands in a push-up position. For ladies, it's going to be on their knees, and they are tapping the dorsum of their hand and returning back to that 36-inch mark as fast as they can.
Yeah.
You have to get equal in order to start that throwing program.
They're tapping dorsum of
the contralateral hand. So they're like slapping the back of their hand, slapping that hand back to the starting point. We also have a push-up endurance test, 2 rounds, 15-second AMRAP, as many reps as you can. The standard, the brachium has to break parallel and it has to return to full extension. They need to get a higher number on their second round to just demonstrate that their pec has the gas and the juice and the endurance to actually take them through a throwing program. Once they pass that, that's where we start the throwing process. So throwing process, I'm not picking a baseball up. Throwing process starts with the football, mini football for me. Okay. It's a much more comfortable position. It's not as much layback. It actually teaches a lot of index and middle finger pronation and flexion through it, so they can actually start to develop some more dexterity in their fingers and start to feel their wrists start to come through. 3-ish weeks with football, 2-3 weeks.
How many throws?
I typically go with the standard of start with like 20. Let's see what that feels like. We'll go for every other day. It's pretty low impact. I'll maybe go 2 rounds and I'll start to back it up as they're comfortable. I'm not going to go, 30, 40 yards or anything crazy there. I might get to like 20, 25 yards, but I think it's a really good gap to bridge from med ball exercises into throwing a baseball.
Yeah, great idea.
So from there, that's when I start my traditional throwing program. Once pain is under control. If they're not having pain with throwing a football, that's a good indicator that, hey, a baseball is going to go pretty solid.
Okay. And what does that look like?
What does the throwing program look like?
What does it look like once they pick up the ball? What did it used to look like before Mike Reinold shook up our wall?
So the traditional throwing program was an every other day schedule, and I'll get into what I don't like about that. I think every other day with a post-op arm in general, that is a lot of volume with not a lot of break time. And that's one of the big changes that we see in the new one is that we have a additional day of rest in there. It is a Monday, Wednesday, Friday schedule with a 48-hour consecutive day off. So there has to be a weekend off. You can sprinkle it throughout the week, however you like, however your schedule works, but there has got to be a 2-day consecutive break from throwing whatsoever. Starting at about, I believe it's 30 feet, you're going to throw about 20 balls, 2 rounds. And some of the other problems that we see with those traditional ones is that they give a range of throws, 20 to 25. That adds a variability, confounding variable in there that we can't really control. We can't successfully monitor. So Mike Reinold did a nice job of just making it as easy to read as you can. There is a certain amount of throws you are going to throw. You are not going to deviate it. You are going to do it on this schedule. There has to be a 2-day break. So that kind of helps with monitoring like the total volume. The throwing progression with a traditional throwing program is going to be about 2 days at 2 rounds of 20 throws, 20 to 25, followed by 2 consecutive sessions of 3 rounds of 20 to 25 throws. So when you add that, that additional 5 reps, you have the opportunity to add upwards of 45 additional throws from week to week.
Yep.
Not considering your change in number of rounds. So there's already almost 50 reps of, hey, I felt like doing an additional 50 reps.
So why'd they do that?
I don't know. I truthfully don't.
When did the first one come out?
Over 20 years ago.
Okay, so first one comes out 20 years ago. They have all this variability in it, which used to drive me nuts. Now he's really cleaned that up, right? So he's cut down number of reps. He's giving you more rest time. He's more concrete about how often he wants you throwing. And by the way, you can download a free version of it off Mike Reinold's website. And then what did he do to overall length of return to throw?
So this is the selling point that's going to be tricky for PTs to patients. The selling point is it is longer. Unfortunately, it is longer, but it is much more replicable of traditional training for a pitcher. So gone are the days of the guys that throw 88 to 91 in the bigs, right? Most guys are going to be touching 96 at the very minimum. Those guys take an absurd amount of time to get up to that threshold. When you start throwing and you're just going to the point, pardon me. When you start the throwing process and, sorry, I lose my train of thought. Rephrase that same question.
So we were talking about like how long it's now going to take guys to get back.
Right. There we go. So the length allows for you to stretch that time out and really work on something called acute chronic workload ratio. So Mike Reinold talks a lot about it in the study and breaks it down beautifully. So acute workload is going to be the amount of throws that you threw, the amount of stress that gets put on that elbow in 1 week, compared to the chronic workload is going to be over the last 28 days, so 4 weeks. So we want to keep that number within a certain threshold. And the only way that you can really calculate that is with something called a driveline pulse. Are you familiar with this?
Yeah.
So for those who haven't heard of a driveline pulse, it is a little sensor attached to a band that goes just distal to the elbow joint. And it basically measures the amount of torque that is placed on the medial elbow complex of valgus torque. It takes the number of throws, the intensity of the arm speed, and then the amount of days that you do that through the week to calculate your acute workload, and then compare that to your chronic workload. You're trying to keep a value between 0.7 and 1.3. Now, when we see this is where the differences in the program really come to light, is Mike Reinold's program, a very, very small majority of that time is outside of that danger, or outside of the safe zone. Rather, we see a tremendous, a 15 times increase in injury risk once we get above 1.3. And we find that the original throwing program deviates from that safe zone for about 20 to 25% of the program. So we're in some danger zone. The chronic workload is where it really gets kind of spicy. So in that 4 weeks or the 4 months that we're throwing in the original, or this would be in the updated version, our chronic workload, when we look at the very end of it, we're trying to get as close to mid-season workload without getting above it. But when we get into, and a safe zone for that, I know this is kind of just sounding like random numbers, but that number is 12 to 15. So the workload has to be between 12 and 15. You will find that in a healthy mid-season athlete. That is their workload for, say, the summer. Mm-hmm. When we are looking at the original interval throwing program, we actually get into mid-season workloads at the end of 3-4 months. So that is a rapid increase in throwing volume that tends to flare that arm up a lot. So I know, personally speaking, and a lot of my patients with that original program, they start reporting some soreness like pretty early on. Yep. And we got to modify and add rest days in there. So I tend, when I was working with the original program, there was a lot, I modified it a ton. Yep. Just because we needed more of those rest days in there. And they tend to do really well after a full weekend off. So once I saw that, I was like, we need to add some more rest days in there and kind of lengthen this out. Just because if we're approaching a full season of workload in 4 months, there's a lot of opportunity for things to go pretty bad.
Yeah, you're not ready for it.
Right. So we do add 2 to 3 months from a beginning to throw to the end of a mound progression. So it is about 7 months in length from front to back, but people tolerate it so much better. Yep. There's a lot less of those days where you have to kind of pull back and maybe punt to the next day. I find that it's much more comfortable. It's a lot easier to read. Patients love it a lot more. And as few setbacks as you can get through a throwing program, that's where you start to really fly through it.
Yeah. Now he does a good job of not like putting a velocity component on it, but he does a good job of putting arc of throw into it. Mm-hmm. He works in crow hops into it. Just walk me through like how you coach that stuff and how that kind of shows up along the program.
So I think you touched on it real quick. I want to just kind of expand on that. So the really interesting, this is the coolest thing I've ever read from a study, is that throwing velocity does not indicate stress placed on the elbow. You kind of sit there and think about it a little bit, and it kind of makes sense. As a pitching coach, a lot of times when guys are overthrowing, they tend to co-contract a little bit too much, and they end up throwing slower. So their intensity is higher, but their output is less. So what I would tell that person is, hey, you got to relax a little bit and you'll see that velocity start to tick up. So that's just one small example of, hey, velocity does not necessarily mean stress at the elbow, because, and also effort doesn't. There's days where you feel great. There's days where that ball feels like it's 1,000 pounds and you just can't get it out of your hand. So I really try to encourage people, don't worry about the number and don't think about effort. Distance is one of the only ways that you can confidently monitor stress placed at the elbow. And when it comes to teaching a crow hop or a shuffle or throwing on the run or something like that, those are all just downstream things that we're going to work on after we do a stationary throw. The crow hop is relatively simple. I think a lot of people actually have operated out of one. Yep. There is like that really like springy one where guys jump off the ground, but really I try to teach them, hey, let's do it. Let's just step behind, shuffle into a med ball toss. So when we start our med ball progression or plyo progression, we start crow hopping after a couple weeks of doing just a stationary. It might start with just a short step with their back leg coming behind their front leg into a follow through step. But if you can teach them just, hey, step behind and then follow through with that front leg, that's practically what a crow hop is. A crow hop is just a little bit quicker, maybe a little bit bigger. If you can teach them the shorter dialed down version early, when it gets time to do the big one and the quick one, it tends to really just fall right into place.
Yeah, I love that. Like laying seeds along the rehab pattern to prep them for that end stage stuff. If velocity does not impact stress on the elbow. How do you explain the rash of UCLs at the highest levels of baseball?
So I've done a lot of like digging on this topic. I know Mike Reinold put out a post the other day that was kind of baffled me. I just had to do some digging on it about the uptick in arm injuries. The time of year where they get these injuries really tells a lot. And if you understand what those pitchers are doing at that time, it paints the whole picture for you. Most UCL injuries are going to occur in March and April in the big leagues. What's going on there? It's not necessarily they're not ready to throw. What's going on is they're doing some last minute, pitch development sequences or last minute increases in velocity. And when they increase, especially effort on progressing their stuff, or stuff is essentially just off-speed pitches, and they work on a lot of spin, it does tend to flare that elbow up, and it puts them at an increased risk of tearing. So I do want to say that velocity does have an increase, a pretty direct correlation. I would say the medical community in the MLB is pretty consistent on that as we have seen these guys throw harder and harder, we have seen a equal and consistent parallel graph of increase in injuries. Also with increasing the emphasis on like spin rates and producing a nastier pitch, a nastier off-speed pitch, that also places a lot of stress on it too. And especially when we think of young guys throwing off-speed pitches, all of these effects are downstream too. So we're going to start to see those Division I guys have to get those velocities super high, their stuff really nasty. And that starts to bleed down into the high school level. And then you start to see these 10, 12-year-olds throw a fastball in a tournament and look right to the radar gun. Yeah. So that's kind of the gist of it.
The time of year is interesting.
Yeah, the time of year really blew me away.
And to you, that means what? That means they're rushing things in order to what? Make a team? Compete?
Yes and no.
Maybe.
I kind of have a solution.
Great. If you could just solve that.
Right. I wish, if I had the answer to everything. I think the solution is a little bit less sexy to get after the problem. The problem is that last minute increase. It is kind of like rushing and making sure that you're looking really, really solid. So in spring training, I think there's a huge stress on, we need to get into midseason form right away. And if, say, Aaron Nola, I'm a big Phillies fan for those who are listening. If Aaron Nola comes out there first mound visit and he's throwing like 87, everybody's going to be thinking, whoa, what is he doing? Yeah, but you said
velocity doesn't matter.
Velocity of the throw in the return to throw does not indicate the increased stress at the elbow. Right, yeah. Right. So now that's kind of tongue-tying me a little bit.
Yeah. I mean, we've seen it. Listen, we've seen an increase in injuries as velocity has ticked up. Like you said, it would stand to reason that increased velocity increases impact on all joints at play, but specifically the elbow, right? Timing of year is really interesting because either they're not ready, they're not in midseason form, and they're asking for midseason production, or they're bearing down because they need to make a squad or they need to impress, et cetera. I mean, there are just so many different variables. But is Reinold making the claim? Should get him back on the podcast because I had him once. Is Reinold making the claim that it doesn't like that the uptick in velocity is not correlating to injury rates?
I don't think he's indicating that. I think he's indicating more of, in the recovery process, we have to be a lot more direct of monitoring what stress is being placed at there so we can keep them in a safe range to progress slowly. With reading the research from you can find this at MLB.com. It seems that the everybody is really pointing towards velocity is leading to these increase in arm injuries. Where the parallel and where the intersection is of, hey, is monitoring velocity not a good idea? I think that's actually really fascinating conversation to be had. I want to say velocity and effort are probably the two things that we can't consistently monitor. So it's not necessarily that, hey, throwing velocity in the return to throw process increase in velocity isn't causing the increase in injuries. I think where Mike Reinold's getting is, if we monitor velocity, that's not a really good indicator of consistently measuring the stress placed at the arm, because velocity is going to change day to day for each person. Some guy's going to throw 88 one day, and then, next week they throw 91.
Yeah.
So I think there's a lot of variability in the person itself between velocity and stress.
Yeah.
Though it might be the same pitch, it might be the same effort. So I think it's more of the inconsistencies of measuring confidently of, hey, this guy's throwing really hard today. Hey, this guy's throwing really poor today.
Yeah.
So it's more, I believe it's more of that conversation.
Hey guys, quick pause and a quick shout out to this new masterclass that we just launched here at True Sports Physical Therapy. Myself and Dr. Tim Stone put together a masterclass of ACL rehab, and we call it From Table to Turf. And the reason we call it that is because it's going to teach you exactly how to get your athlete all the way from post-op day one with the nitty-gritty of regaining all of that range of motion, with the tips and the tricks that we use here at True Sports Physical Therapy that gets our athletes better, faster, and stronger. And that's early. And then how do you progress that athlete all the way onto the field with a ball in their foot or a stick in their hand or whatever their sport is, and teach them how to accelerate, how to decel, how to change direction, all the mechanics that go in there. What drills do we use to get our athletes exactly where they need to be back on the field and even better than before injury? And I want you to sign up for that class now. You can find it on our website. You can shoot us a direct message and just say, hey, send me the course. It's right now on sale, so make sure you sign up now. It is fully accredited to get you all of your continuing education hours. Sign up for the True Sports Masterclass ACL, From Table to Turf. Thanks, guys. What I appreciate about the return to throw is it's not velocity based, and it's more external or extrinsic cues with what does the throw look like, what is the distance, things that are outside of the athlete. We know that self-reported levels of effort are not commensurate with actual output. Mm-hmm. Like a guy might think he is throwing 95 and he's not, and vice versa. So I just think that the kinematic sequencing or the kinetic chain is so complex that there's so many variables. Mm-hmm. I'm also fascinated by how much spider tack and grip has to do with it. Mm-hmm. Like we saw a massive level of decrease in spin rates, obviously, but also increase in injuries when we took away spider tack. And then what do you think about the pitch clock?
I know we've talked about this before. Yeah. I want to see what that number looks like in 3 to 4 years. My initial thought, I think there's two things that happen. There's two outcomes here. Pitch clock is either going to increase fatigue to a level that the muscles are not safe enough to co-contract and protect structures, being that it is a more cardiovascularly now dominant movement. They are throwing a pitch every 13 seconds if the batter takes a pitch, 20 seconds if they foul it off. My misunderstanding, and what I think we'll find over the next couple of years, is going to be, is that cardiovascular component going to limit output? Therefore,
it's cardiovascular. I think it's muscular endurance.
True. I want to see if it is going to affect their ability to produce force, and if they're throwing not as hard, that is less stress through the elbow, or does that put them at a higher likelihood of injuring themselves because they have more fatigue in the system?
Yeah,
we do see now that the outings are much shorter. So we see a lot more of those 5-inning guys. It's much more difficult to throw a 9-inning complete game with a pitch clock.
Doesn't happen.
It rarely happens nowadays, because it is very demanding just to throw a complete game in general. Yeah. With no pitch clock. So it's not something that I've actually played under. I've never had a pitch clock implemented. I'm curious to see what that number looks like in 3 to 4 years. I think we'd probably have a better answer.
Yeah. It's a better sample size. I also wonder how well they can adapt. Yeah. I also wonder, I don't know the answer to this, whether strength and conditioning at the big league level, they have it in college or not.
Strength and conditioning coaches?
Yeah, I would hope so. But pitch clocks?
Pitch clocks, they do have that at the collegiate level.
They do have it at college. Okay. Mm-hmm. So I just wonder if it's changing the way guys are training or being trained. Like, are they changing their rest breaks to be more commensurate with what it looks like on a pitch?
I sure as hell hope so.
I would hope so, but Dude, if you listen to the interview I just had, it's like sometimes, or I would say very often, the levels of strength and conditioning, the levels of rehab are not commensurate with the levels of athletes, unfortunately. So I don't know. I don't know if it's happening, but it would make a lot of sense that they would be. So I think that's a good point. Like we'll see kind of down the road when we get a bigger sample size. Give me some resources, because obviously you've done a ton of research. Give me some resources for our audience to become outstanding baseball rehab professionals.
I really like the courses that Mike puts out. I'll start that. MikeReinold.com. You can find a lot of great information. There's also another company called Jaeger. They're famous for making called J bands or Jaeger bands. You'll see those guys at tournaments. You'll have the 2 TheraBands with 2 Velcro hand grips or wrist wraps rather, and a clip on the other end to clip onto the cage and be able to do a ton of different exercises. They have one of my favorite just general maintenance long tossing programs. It's very customizable to the athlete's level of competition, their skill level, their arm strength levels. It's very, very customizable.
Cool.
But they also have a lot of different training programs on there too. They also have an upper extremity plyometric progression. They have strength programs. They have conditioning programs. They have a lot of resources out there. They have a ton of stuff for coaches and full teams. You can basically buy like a kit and just have a ton of information at a coach's level. Other areas I look at. Oh gosh, I'm blanking on his name. Oh, the Biomechanical Man on Instagram. I'm blanking on his name, but the Biomechanical Man on Instagram, he has a ton of those mechanical pieces that I think are left out of the study for good reason, because they're really complex. Things of like arm trunk angles, trunk tilt, pronation angles. He's got a ton of great videos of actually showing you how he goes through the biomechanic analysis of sensors on the body, throwing a bullpen, and showing studies. He drops studies on his Instagram all the time.
That's cool.
A really fascinating guy, extremely smart.
Yeah.
But talks in a way that it makes a lot of sense.
That's awesome. Have you done any of the on-base use stuff?
I started it. I haven't gone through it. I'm really liking where it's going.
Yeah.
Their mantra that I have really taken full to heart is there is not the optimal way to throw. There's an optimal way for you to throw. So as long as you're moving in a certain sequence, you can safely execute a good throw.
Yeah.
And I think that tends to go with any sort of arm slot style of throwing. If you're a sidearm guy, these things still have to occur. Trunk rotation, hip rotation has to occur before the shoulders start to turn.
Yeah.
There's a couple there. It's a really great program. That's another one that's really easy to make sense.
Yeah.
And they show a lot of different EMG studies and live EMG data. And you can start to see as the player moves, how is that force being translated throughout the whole kinetic chain?
Yeah. And I was fascinated by that. I went through on-base use certification. I also love the way they break it all the way down, because I think it can be such a daunting task to break down a pitcher's movement or the movement of just throwing a baseball. So what should be transpiring at the ankle, what should be happening at the knee, hip, and working your way up, and what tests can we do to measure? Like, is this the issue that's causing whatever deficit or whatever level of pain? I love that. And you make a really good point, which I would have missed, which is they line up mobility. They line up certain strength parameters that have to transpire. Really, mobility, they do it more of in terms of stride length, because my stride length is not going to look like your stride length. Those of you who are listening, me and Ethan Hurd are built a little bit differently. So, but ways to measure that, ways to understand that, and ways to implement our interventions was designed by a chiropractor, Maryland guy, actually, who did the TPI stuff. So there's some of that health understanding or the pathophysiology understanding. So I highly encourage the on-base U world. Of course, our boy, friend of the pod, Eric Cressy, has a tremendous amount on strength and conditioning. Anything else that you think is like a Bible you got to go through if you're going to rehab baseball players?
I think really if you just watch, I think there's a ton of videos out there of different pitching coaches. Pitching coaches are a really underutilized person in this mix. So if you're somebody that's not really confident on looking at biomechanics or pitching mechanics right off the bat, see if they have a pitching coach that they already work with, or see if there is somebody in your like local hometown that does a lot of pitching stuff. So I follow a number of just pitching coaches. I also follow a lot of like catching coaches. Like Jerry Weinstein is my favorite catching guy. He's a wizard.
You know why I love Jerry Weinstein? Because he was the manager of Team Israel World Baseball Classic.
Was he really?
Yeah.
Dude, he is a stud.
He never took toothpicks out of his mouth.
No way.
Yeah. It's amazing.
I guess that's where the toothpick comes from.
That's where the toothpick comes from. It's crazy.
That makes sense now.
How do you discern, I hate to say good and bad, but a pitching coach that has an understanding of biomechanics? Because I think that's what On Base U does, is they give everyone a language to speak. The PT is speaking the same language as the strength coach and the pitching coach. Too often we're living in a biomechanical world, they're living in a performance world, and never the two shall meet. So how do you discern who knows what the hell they're talking about and what they're saying is good for the given athlete?
Right. So that's another really interesting conversation to be had. My number one indicator for that is, what equipment are they holding? If they're a guy that is living off the Rapsodo machine, they have their eyes glued to the iPad, that is somebody I'm not going to go for if you're looking for a biomechanical piece. If you have a guy that pulls up a bucket and sits right next to him and is watching them from head to toe, and you can see their eyes scan and start at their feet and then start to work up their hips and see where the problem is, that's where you're going to see that's the guy. I was extremely fortunate enough to see both in action. And I saw, for example, one of my close friends, his father and his uncle and cousin are all professional scouts. So I spent hundreds of hours with catching bullpens for MLB prospects in the presence of this scout. And he was that guy that just pulled up a bucket and just watched him go. And, you know, he's also got a tremendous background. He got drafted. He played in the pros. Digging a little bit on their background never hurts. So if they have a tremendous background in playing, they might be a good coach, but that doesn't necessarily mean it.
I would argue it's the combination of the two. Like, I get nervous when guys are just watching and trusting their eyeballs. Like you said, however many degrees per second that the shoulder is moving, it's impossible for the naked eye to pick up actually what's transpiring. So it's really the combination of watching the athlete, going to the video, understanding how to break down the video. Is there any downside to that? Like, I feel like that's the blending of the worlds.
That's it is. And you'll see pitching coaches that are younger in their career utilize the camera a lot. And I'm fine with that because it can slow things down to a level that we'll never be able to see it at. Yep. And I tend to use a lot of cameras in myself. I mean, we throw outside and I'm putting cameras from their front side, their backs. I'm putting a camera everywhere because I want to know 3-dimensionally, how are they moving? Yeah. And if I'm on the other end catching it, I can't really see that. I can see their front side mechanics and I can give them a couple cues. But if I get a sideways view of their throw and I'm like, oh, there's the problem. Yeah. Hey, this is what we need to do for this. So I think guys that are using camera, I think that's totally fine. Yeah. The things that I get nervous for are the overutilization of Rapsodo. I think that tends to be sometimes a crutch. They have a full, certification. I think Rapsodo gives some very beneficial data, but I think it's used for guys that wouldn't benefit from it as much. So the guys that are younger, the guys that are maybe not at the top end of their level, I'm not going to get them on a Rapsodo. I want to do more of that video cam recording and really break down the mechanics of it and put them on a strength and conditioning program, a arm strength program. The guys that are more so on the top end, they're looking to change that next level. They're looking for a Division I, Division II scholarship. They're nuances, right? The guys looking to make that next jump. Those are the guys that I'm going to be like, I think a Rapsodo is probably appropriate, and that can give you some really good intel on, hey, what is their hand doing?
Which you just cannot get that from the naked eye.
Right. That is something you can't see how they're using their finger, but you can directly see what the ball is doing once it leaves the hand, and that can really tell you, hey, you're cutting that fastball. Yes. Some good pitching coaches will see it. You can, as a good catcher, could also probably see it. I never used in my training a Rapsodo, so I utilized a lot of my analysis of how they executed.
Think about the levels you could have reached.
True sports physical therapy is growing like wildfire.
We have 14 locations, soon to be more. We are throughout the state of Maryland. We're in Pennsylvania, in Lebanon, in York, Pennsylvania, as well as in Delaware, in Newark and Wilmington, Delaware. Like I said, so many more practices to come, and we always need outstanding sports physical therapists. Our treatment style is unique. We are one-on-one with your athlete for 45 minutes every single session. You do the entire treatment, you do the entire evaluation, and they are in state-of-the-art facilities where you have room to run, throw, and jump, and really get your athlete all the way back to on the field and better and stronger than they were. We also have outstanding salaries, comp structures, bonus abilities, 401ks, as well as a very strong continuing education offering, including in-house continuing education. And we're looking for you. Now is the time, as we are growing like crazy. Just shoot your resume over to Yoni, Y-O-N-I, at True Sports PT, or shoot us a DM, and we will hit you back. We will get you in for our unique, tried and true interview process and really make a determination that this is the right place for you to grow your career and get your athletes better than ever. We can't wait to hear from you. Let me ask you this. In 20 years, like if Reinold looks back at his work with Wilk from 20 years ago and says, what the hell were we doing with this acute to chronic workload ratio? Let's revamp this thing. What do you see as happening in 20 years from now?
Ooh, 20 years from now.
I mean, is there anything you would change about Reinold's updated return to throw? Anything you wish you would have considered?
The one thing, another piece that I really like about is there's a lot more time spent at each level, and I think that was another one that was really important. I would like to see more of a position specific progression for each. I think position player is kind of is more of a loaded term. You know, you got catchers that throw completely different than second basemen. Second basemen throw completely different than center fielders. So if there's something that we can improve on, if we can make it a little bit more position specific for the position player, I think the pitching program is excellent. I think the long toss program is excellent. I think we need to bridge the gap between the end stage of it, and let's get them into a position. How can we make the throwing program turn into, hey, how are we gonna field a fly ball with this? And there's different things that you can do as your personal practitioner. You can implement those things and make that a better, smoother transition.
But I can see that being rolled out, and I think also like as our ability to learn the kinematic sequences for different positions, that would be interesting to then incorporate that into the way we coach, the way we return to throw for different positions. So I could totally see it, hopefully before 20 years.
Yeah, for sure.
Hurdy, it is insane how good you are at this for compared to how long you've been treating. Just close up with kind of some words of those listening that are new to this world, how they can decrease that learning curve.
New to the PT world?
New to the sports PT world. Yeah, you're coming out of school.
Right.
You're like, hey, I want to be Ethan Hurd. How do we get them there quicker?
You got to be a sponge, and you got to be able to admit when you don't know something. And it is not a dig at anything, like your knowledge base. There's PTs that have been in the business, twice as long that I have, or, 5 times as long as I have. Right. And there are things that I know that other people don't. And there are sports that I played that not a lot of people have. Nobody treated and nobody's wrestled in timonium at all. So any grappler, like I get grapplers a ton. So I think being able to admit, hey, this is an area that I am not super confident in. Talk to me like I'm 10 years old. And how would you go about this? If you are able to dial in those questions of, hey, I did some digging. This is what I found. What's your understanding of this topic? How would you go about this compared to what they're saying in this study? That was something I developed, question asking as a student. I was always complimented on the ability to ask a good question. And that always came from me doing personal digging at home, coming up with my own response, going to somebody a lot smarter than I am and being like, hey, what do you think about this? If you have that humility, you're going to be good. I think a lot of it comes from a pride thing. And me, I'm about as non-prideful, prideless as it comes. Humble.
Yeah.
There you go. I'm so willing to learn from somebody else because somebody's going to know more than I do, and I am okay with that.
Yeah. Yeah. I mean, the good news is, just speaking to our audience, is we're in a profession of educators. I mean, so much of what we do is teaching. We teach every single patient every single day. So just kind of rallying around that, like PTs around you should love to teach. And if they don't, they're assholes. But you should be surrounded by at least someone in your given clinic or in your university that is there. They want to hear those questions. So to your point, don't be too prideful that you're not going to come forward with a question. I think that's awesome advice. Hurdy, you freaking killed this thing. I appreciate your time dearly. Tell everyone how they can find you so that they can become the next Ethan Hurd.
So my Instagram is dpt.hurdy, HURDY. Please feel free to shoot me a text, shoot me a message. I am more than willing to text people, especially if you have any sort of like specific question. That's my favorite, is when you listen to it carefully, do your research, come up with a really like targeted question. Those are the ones I like to answer the most, but I am an open book. I am more than willing to talk to anybody, because I was that bright-eyed, bushy-tailed student that had absolutely no idea what he was doing. And I probably looked like a deer in the headlights first day.
Yeah.
We all were at that point. It's all a matter of, hey, are you willing to just ask the freaking question, or do you want to kind of like keep to yourself a little bit?
Yeah. So hit up Hurdy, asking some questions. As always, I encourage feedback on our pods on how we did today. So hit me on Instagram, True Sports PT. I'll get back to you. Let me know who you want to hear from. Let me know what you want to hear more of and what I screwed up in this interview. Always trying to learn. Hurdy, you've been an inspiration. Thanks for all you've done for us and for your patients.
Thanks, sir. I appreciate it.
Good freaking work, dude. It's the True Sports Physical Therapy Podcast. Tune in. You might just learn something. Catch all of the full episodes on all streaming platforms. And as always, the link is in the bio.